This is the hypoglossal canal. This region is the hypoglossal canal, and this region is the superior orbital fissure that is present just below the the lesser wing of the sphenoid bone. This is the superior orbital fissure. And now coming to the inferior surface of the skull, inferior view of the cranium. This, first of all, this is the maxilla. This bone is maxilla, and this suture, which is dividing the maxilla into two parts, is the intermaxillary suture, and this fossa is the incisive fossa. This intermaxillary suture has divided this into two palatine processes. So these are two palatine processes, and this suture, which is separating the maxilla from the palatine bone, is the palatomaxillary suture. Now this whole structure is the palatine bone. Now this region is the posterior nasal spine, and these are two horizontal plates of the palatine bone. And now these two are the greater foramen. These two are the greater palatine foramen, and this one is the lesser palatine foramen. These small foramen are the lesser palatine foramen. Now this region just lateral to this spine, small spine, just lateral to this is the pyramidal process of the palatine bone. Now this spine is a part of the sphenoid bone. Okay, now coming below here, these two spaces, two spaces that you can see here, these two spaces are the cornea, and this straight line that is dividing it into two parts, this line is the vomer, and these two parts are ala. These two parts are known as ala, and the central division, the central dividing bone is the vomer. And now this region, this whole of this region is the pterygoid process of the sphenoid bone. Now the pterygoid process has a medial plate on the medial aspect and a lateral plate on the lateral aspect, and this is a central fossa is known as the pterygoid fossa, and this fossa is known as the scaphoid fossa. It is present on both the sides. Now this sphenoid bone has the same foramen that was present on the superior view. Now these foramen are present on its inferior aspect as well. Now this foramen is the foramen lacerum, just lateral to the body of sella turcica. This is the foramen lacerum. Now this is the foramen ovale, and this smaller one is the foramen spinosum. On both sides, these all of these foramina are present on both sides. And this is the internal acoustic meatus present on the pitras part of temporal bone, and this is the styloid process of the temporal bone. Styloid process of temporal bone, these two are the styloid processes, and this is the pitras part of temporal bone, and internal acoustic meatus is present on the pitras part of temporal bone. Now these two are the external acoustic meatuses. These are the internal, and these two are the external acoustic meatuses. Okay, now coming back here, this is the greater wing of the sphenoid bone, and this part is the zygomatic process of the maxilla. This whole is the zygomatic bone. This is the zygomatic bone, and it is the temporal part of the zygomatic bone. Now this is the whole of this is the temporal bone. It contains the styloid process, the external acoustic meatus, and this is a fossa for mandible. The mandible, the lower jaw bone, the head of the condylar process of the mandible fits into this mandibular fossa. Now this is the mandibular fossa, and this is the mastoid process, and the foramen that is present in between the styloid and the mastoid process of temporal bone, this foramen is known as the stylomastoid foramen. And now there is a notch on this side, on both the sides. Now this notch is known as the mastoid notch, and it is the point where the digastric muscle attaches on the mastoid notch. Now this is the occipital groove for the occipital artery. Okay, now this is the occipital bone, and these are the condyle processes of the condyles of the occipital bone, and this is the condylar canal on both sides. Now this is the external occipital protuberance, this one, and this is the superior nuchal line on both sides, and this is the inferior nuchal line on both sides, and this one is the external occipital crest. It is dividing the occipital bone into two parts. Now coming back here, here we have the zygomatic process coming from the temporal bone, and it is joining the zygomatic process coming from the maxillary bone. So this is the zygomatic bone. And now coming on this aspect of skull, this is the glabella. This region is glabella, and these are the two orbits which contain the eyeball and the extraocular muscles. This portion, this bone, is the lacrimal bone on both sides, and this bone is the nasal bone, and this suture is the nasion. Okay, now coming into this aspect of nose, this is the this part is known as the vomer, and this is the inferior nasal concha, and the upper ones are the middle nasal concha, and these are the inferior nasal concha, and this plate is the perpendicular plate, and these are the alveolar processes of the maxillary bone which lodge the teeth in them. Now just above the orbital is the supraorbital foramen, and just below the orbital there is an infraorbital foramen, and this is the zygomatic bone. So this is the frontal process of the zygomatic bone, and this is the temporal process of zygomatic bone, and this is the orbital surface of the orbit. And now coming back here, on this aspect we have from the superior orbital fissure, the optic nerve and the ophthalmic artery enter into this orbital cavity and supply eye with blood, and the ophthalmic artery then passes on to this frontal aspect of the forehead and supplies the scalp on this region, on the frontal aspect of the forehead. Now this is all about the inferior surface of the skull as well as about its facial bones.